His Excellency Dr. Alex Otti, OFR, inherited a health sector that was comatose at the primary, secondary and tertiary levels. Active and retired health workers in the state were taken for granted and abandoned as they were owed months and years of salary and pension arrears. Though infrastructure totally collapsed, Abia State University Teaching Hospital ABSUT lost accreditation to train medical students. Abians were left to the mercy of private healthcare service providers, with many left without access to healthcare services because they cannot afford it. To revive and restore quality and affordable healthcare to Abians, Governor Alex Otti, OFR, took some of the following deliberate strategic actions. First of all, he declared an emergency in the health sector as he assumed office. In the last 2 years, he allocated 15% of Abia State annual budget, making Abia the only state to have consistently allocated 15% of her annual budget to the health sector, thereby fulfilling the Abuja Declaration of 2001 mandate that African Union member states allocate at least 15% of their national budgets to the health sector. Governor Otti, immediately after the verification exercise, commenced the payment of 22 months of salary and pension arrears owed to health workers at the Abia State University Teaching Hospital, ABSUT, Hospital Management Board HMB, and so on. Governor Otti approved a new salary scale for Abia healthcare workers, Abia State Health Workers Salary Scale, ASHWAS, with effect from May 1, 2025. With these, Abia healthcare workers will begin to enjoy the same pay as their federal government counterparts. The state government launched the formal sector health insurance scheme to provide accessible and affordable healthcare for Abia workers. Based on the result of the needs assessment performed across the health facilities and agencies of the Ministry of Health, Governor Otti approved the recruitment of 771 new health workers, including doctors, nurses, pharmacists, medical lab scientists, physiotherapists, radiographers, and other categories of healthcare workers. Within 100 days in office, Governor Otti revived, restored, and retrofitted the comatose Abia Specialist Hospital and Diagnostic Center, Umuahia. At the same time, delivered a world-class eye center with gates thrown open day and night to attend to the healthcare needs of Abians. The governor has revived, retrofitted and restored Abia State University Teaching Hospital from decades of neglect and ruins, and the lost accreditation to train medical students restored just a few months after he assumed office, as the requirements of the Medical and Dental Council of Nigeria (MDCN) were quickly met. At the primary healthcare level, the contractors and consultants handling the renovation, remodeling and retrofitting of 200 primary healthcare centers across the 184 wards of the state will soon hand them over to the state government. The renovation and remodeling of another set of 200 primary healthcare centers will commence immediately after the first 200 are completed, as firmly promised by the promise-keeping governor of Abia State, until all the 948 primary health centers in the state are completed. At the secondary healthcare level, 5 general hospitals, Obingwa, Okikpe, Ikwano, Ohafia, and Arochukwu, are currently being renovated and at various levels of completion. On completion of the renovation and retrofitting of the 5 general hospitals, another set would commence. Umunato and Amachara general hospitals have been upgraded to specialist hospitals and are undergoing serious work. Mporo and Abai cottage hospitals have been renovated and retrofitted for public use. The administration of Governor Otti has successfully attracted $1.3 billion for the Abia Medical Village project, a project that, when completed, will reverse medical tourism abroad to Abia State. A brand new auditorium is being built at the Abia State University Teaching Hospital as part of the Phase 2 upgrade of the state's tertiary health institution. Other general hospitals, including Akaba General Hospital, Abriba, are at the redesigning stage. The building of 3 brand new general hospitals will soon commence in Abam Community, Okwa East, and Omonochi local government areas to serve the people of the areas. In the last 24 months, the state has partnered with various foundations to offer free medical interventions in general medical consultancy services, treatment and surgeries, cataract removal surgeries, and free hearing aids distribution. Abia State has been on the global map for the right reasons in the last 24 months. To the glory of God.
Dear Ezihe Onoha, the Executive Chairman, Abia State Universal Basic Education Board. Since the inauguration of the current leadership of the Abia State Universal Basic Education Board, ASUBEB, under my leadership, we have recorded significant progress and transformational achievements. May 29, 2024 marked the turning point for basic education in Abia State as ASUBEB rolled out a series of landmark initiatives that underscored its unwavering commitment to innovation, accountability, and inclusive educational development. And guided by a robust and context-specific technical framework, the board implemented pioneering strategies designed to respond effectively to the unique educational challenges within the state. These efforts were informed by a comprehensive school-level baseline surveys and a holistic organizational assessment of ASUBEB. The findings highlighted the urgent need for a comprehensive school improvement strategy and a total restructuring of the board's organizational systems, including the organogram, internal processes, and governance structures. In a bold and historic move, ASUBEB has, for the first time in over 15 years, redefined its vision, mission, and core values to reflect its new strategic direction, realities of contemporary governance, education reforms to align with the broader transformation agenda of His Excellency Dr. Alex Chioma Otti, OFR, the Governor of Abia State. This milestone and redefinition process was deeply consultative, involving engagements across departments, extensive policy reviews, and participatory meetings with staff to ensure broad-based ownership and alignment with the broader objectives of the state's education sector transformation. And with this, ASUBEB came up with a new vision that aligns with the transformation agenda of His Excellency Dr. Alex Chioma Otti, OFR. Our new vision is to be a leading institution in providing inclusive, equitable, and high-quality basic education that empowers every child to achieve their fullest potential, cultivating a foundation of lifelong learning. And our new mission is to deliver high-quality basic education to all children in Abia State through strategic partnership, continuous teacher development, skills acquisition, effective governance, innovative educational practices. And so, in line with our vision, we set out to achieve a lot in the past 12 months. Some of these achievements include a baseline survey, a diagnostic study of the basic education sector. This survey gave us insight into the challenges, the gaps, and what exactly to prioritize. The data informed our preparation for teacher professional development, the training of master trainers, the setup of Abia State School Enhancement Team to support teachers daily, right in their schools, right in the classrooms. We're able to get approval for direct school funding such that schools are funded directly. And so schools get funds every month to run minor expenses in schools. This has helped to stabilize heads of schools. It has also helped to stabilize the school system. Part of the achievement that we are so proud of and we brag about is setting up of structures for due process. We were able to get approval for the Universal Basic Education 4-year grant. Before now, we had backlog of unassessed funds. We were able to set up a process for assessing the funds. His Excellency Dr. Alex Chioma Otti was able to support this process, put down the state counterpart funding for 4 years. And this helped to encourage the federal government to also put down its own counterpart fund. So we were able to have a total of 8 billion for the 4-year period to help with infrastructural development of our schools, to also help with the provision of monitoring and quality assurance of activities in schools. We were able to also follow up with due process in not just assessing these funds, but also in the utilization and implementation of these funds. And we ensured a transparent process of bid opening and technical evaluation of the bids. The utilization of this fund would commence. We were able to secure a place with the Bureau of Public Procurement as part of our due process to train our staff on due process and procurement processes in preparation for the utilization of the UBA grant, we were able to conduct staff verification of over 12,000 staff in both the headquarters and the field offices. This verification, staff verification, is unprecedented because we're able to digitalize filing system such that all the data of all our staff is now digitalized. The approval of the smart school, as approved by His Excellency Dr. Alex Otti. Recently, he approved 20 smart schools to be set up in each local government in the state. The board also supported the process for the commencement of this exercise. We supported the training of over 50 teachers on the use of the smart schools. The board also completed a 5-day workshop for the domestication of the National School-Based Management Committee policy. This policy is to ensure that there's synergy and that there's collaboration between schools, communities, and parents, especially now that we are beginning to engage and implement the UB grant with infrastructural development in our schools, in communities. So we need this policy to be able to secure these facilities that are beginning to be put in place in our schools. And so we have a framework now for Abia State School-Based Management Committee policy. We also ensure that our internal terminal examinations are unified. Before now, schools operate at different levels in terms of assessment, but we were able to unify our terminal assessment such that our assessments are unified. All our children take the same level of exams. We start and end at the same time. We also monitor these exams also at the same time. We also recorded a huge progress in the annual school census. The last annual school census took place in Abia in 2015. And ever since, there hasn't been an annual school census. As a board, we're able to collaborate with the Ministry of Basic and Secondary Education to conduct annual school census. We're able to also set up Abia State School Enhancement Team. This team is out to support teachers daily in their schools. We have 50 asset team members inaugurated mid last year, and this team have been out in the field in all the LGAs. We distributed them 2 asset team members per LGA. Each day, they go to schools to support teachers and to ensure that teachers are implementing knowledge gained from the trainings they have had. So in line with the directive of His Excellency Dr. Alex Otti late last year on enforcing free and compulsory education for all children of Abia that are of school age, we also followed up with enforcing this directive in collaboration with the Ministry of Basic and Secondary Education. We're able to work together with the ministry to set up a team named Education Marshals. These Education Marshals are out in the streets sensitizing parents, communities to send their children of school age to school. And we also sensitize school heads to be ready to receive these children as they come in to register. And the turnout was also impressive. We have seen a surge in enrollment, and this also means increase in the demand for facilities. We're also working as a team to ensure that more facilities are in place, to ensure that more teachers are in schools, and also to ensure that furniture are available to meet the teeming number of children in our public schools. In line with this, we also supported the teacher recruitment exercise to ensure that adequate number of teachers are in these schools to meet the teeming number of children that have been registered. We also ensured that the UBA grant is utilized to renovate and retrofit over 97 schools in preparation for surge in enrollment. And this is in addition to the 170 primary schools that the state is currently retrofitting, and the 51 junior and senior secondary schools being retrofitted by the school. This achievement is unique because in the history of UBEC, no state has actually matched this number of schools for renovation. Currently, board is also making preparations for quality assurance services and monitoring and evaluation of projects and project sites. We have set up a monitoring and evaluation team. We have also set up a monitoring and evaluation framework to oversee implementation and utilization of the 4-year UB grant. We are also preparing to assess the 2024 and 2025 UB grant. We are sure that this would go a long way in helping with the retrofitting and renovation and also construction of new classrooms in the state, so that the children of Abia will join their counterparts in other states to enjoy the free and compulsory education that they should get. So on behalf of the Abia State Universal Basic Education Board, I want to express our utmost gratitude to our education-friendly governor, the best governor in Nigeria, the #1 governor, the teacher-friendly governor, for all that he has supported the board to achieve within 1 year. We will continue as a board to give His Excellency Dr. Alex Chioma Otti our full support.